Shalom and welcome again to Secrets of Meaning, the podcast TV arm of Jewish Sacred Aging. I'm your host, Rabbi Richard Address. Thank you very, very much for joining us today. As you know, these podcasts in many ways are designed to talk about issues related to aging, the spirituality of aging, the impact of the longevity revolution on ourselves, our families, our community. That gives us a kind of a really broad brush to which to paint these podcasts with, and we're going to venture off into something that is extremely important and relevant to an increasing number of us as we get older, and that is the issue of hearing loss, what it means, and how to deal with it. And for that, we are very, very pleased to welcome Dr. Barbara Weinstein, professor of audiology and speech and language and hearing sciences at SUNY, City University of New York, if I'm not mistaken.
City University, yeah, CUNY.
CUNY.
Right.
In Philadelphia, what can I tell you?
I went to SUNY, but I work at CUNY.
That's right. There's a difference between SUNY and CUNY.
Right.
So, slicha, I'm sorry. I don't want to mess people up from the two different organizations. Dr. Weinstein, thank you very much for joining us. You're an author of a book called Geriatric Audiology, if I'm not mistaken.
Correct.
And I want to start by giving you a mazel tov because you're about to be awarded this month, in March, an honor from the American Academy of Audiology. So congratulations on that.
Thank you very much.
So we want to talk a little bit about hearing loss and its impact as we get older, because more and more of our generation, my generation, are dealing with aspects of this. I know that when I have my annual physical, part of that annual physical is a hearing test.
That's unusual. That's good.
Really?
I like that, doctor.
Oh, wow. No, I didn't. I just thought I've been doing this for years.
Wow.
She puts these things on and I hear these little beeps and I have to go, I heard that. And she has, and they have told me that in the last 5-6 years, there's some frequencies that I used to hear that I don't hear as much anymore. So let's just get right to the heart of the matter. Talk to me about the impact of hearing loss as we get older.
Okay. So, as we get older, and this does not apply to everybody, but over time, there's degeneration in the cells of the inner part of the ear. And there's degeneration in the nerve fibers that bring the information from the inner part of the ear up into the brain. So when those degenerative changes take place, then it makes it difficult for people some selected people, to understand what people are saying. What's interesting is you said that your doctor said that you're losing hearing for certain pitches or certain frequencies. Typically, for those people who lose the hearing as they age, we lose the hearing in the higher pitches, the higher frequencies goes first. So that would be, for example, the S's, the SH's. So, and what's interesting is that those higher pitch sounds are important for understanding speech. So that by losing those higher pitch sounds, it's going to be difficult to understand certain words. But nature or the human body is a pretty amazing thing. And the sounds that we lose in terms of our ears, we can see in terms of our eyes. So that when you combine your vision and your hearing, it really helps to understand, especially the sounds that we lose. So for example, the S, you could see an S on my lips, you could see a sh, you could see a p, you could see a t. When during COVID, that was a real problem for a lot of people because you couldn't, especially for the people who couldn't hear, who lost their hearing, and then we all had masks on so they couldn't see. So they were compromised. And then we had the distance issue as well. If we're more than 3 to 6 feet from people, sounds get softer. So basically, as we get older, we lose the ability to hear the sounds at higher pitches, and we could support that by combining vision and hearing.
So I hear this all the time, me included. We're out to dinner. Eventually, or not eventually, it's not unusual. It says, it's so loud. I used to be able to to enjoy this more, but now it's too much noise. I can't even hear you. That's
Right.
not unusual, right?
So it's not that you can't hear, you can understand. So what's interesting is that in the restaurant, and so the other thing about the hearing loss as we get older is that your hearing for the lower pitches oftentimes is is not as bad as it is for the higher pitches. So your hearing in the lower pitches is adequate oftentimes. That means you can hear the noise very well. So the noise, though, what it does, it masks out those softer sounds that you have a hard time hearing because you have the hearing loss. So I can hear you, but I cannot understand what you're saying is exactly what's happening. You can hear the person talking because you have that low frequency hearing, but you can't understand because of the loss of the degeneration in the cells and the nerves.
There's some very interesting statistics that I just want to share with you, and which you, I'm sure, know, but the people who are listening or watching, they come from the American Academy of Audiology. They say 30 to 35% of adults between the ages of 65 and 75 suffer from hearing loss, and 40 to 50% of adults 75 and older, that'd be me, suffer from hearing loss.
And then 70% above 85 suffer from hearing loss. So it's increasingly prevalent with people living longer. People are living longer with hearing difficulty.
How do I know? And this maybe sound like a very elementary, silly, simple question. How do I know that I'm experiencing hearing loss as opposed to just being in an environment where it's difficult to hear? Like, I'm at a Phillies game. There's 40,000 people booing, and I may have trouble hearing the guy next to me. Is that may be different than sitting across from them in a class? How do I begin to understand that?
So I just want to make sure to distinguish between hearing and understanding, which is why I'm making that distinction.
Okay.
Because oftentimes, if you ask somebody if they can hear, they'll say yes. But if you ask if they can understand, they'll say no. So some signs of difficulty hearing. So, for example, if you have to turn the television up loud, that's one clear sign. If you ask a family member to constantly have to repeat what they say a second time or a third time, that's a sign of hearing loss. If you feel tired, if you experience listening fatigue, if you, like, as a rabbi, you're speaking to people all the time. At the end of the day, it might be you might have some listening fatigue because you're putting so much energy into listening. People don't think about that, but when you put a lot of effort into listening and communicating, sometimes you're tired at the end of the day, which people don't really appreciate. If you tend to kind of look at people and kind of focus on people when they're to try to listen harder, that would be a sign of hearing loss as well. Difficulty understanding in groups is typical. Difficulty understanding if you have your grandchildren. That's one of the major reasons why people come in. They have difficulty understanding the television, difficulty understanding family and friends, and difficulty understanding grandchildren.
The choice of hearing aids.
Mm-hmm.
Many of us I remember going through this with my mom. It would seem to me that there is such a wide diversity in choices.
Mm-hmm.
If I now come to the conclusion, I've gone to the physician and that's the suggestion, it's the recommendation, it's what you need now. How do I begin to make an informed decision about what kind of hearing? Because evidently there's lots of different types of those types. And I just saw somebody the other day, it was connected to their iPhone.
Right. They're all connected to the smartphone. Yeah.
So could you walk us through sort of like introduction to hearing aid 101?
Yeah. So first, let me say that the physicians oftentimes, MDs, that is, they oftentimes undervalue and underappreciate how important hearing is. And that's why it's unusual that your doctor does that screening, but most doctors do not, unless somebody complains about a hearing loss. So the United States Preventive Services Task Force does not recommend hearing screening on a regular basis unless somebody complains about the hearing loss. The World Health Organization does recommend screening. So it's really a good idea to see a hearing professional. Oftentimes, so what audiologists have, people have, remember elementary school, you'd have to raise your hand if you hear a tone. So we do a hearing test and we plot the hearing on an audiogram. Oftentimes, if a doctor just looks at an ear doctor, for example, just looks at that audiogram, he'll often say to the patient, well, you don't need a hearing aid. Your hearing is not bad enough. You can't just go by that. You have to go by how you perceive the hearing. You perceive hearing if you have a hearing loss or not. So no, it's really, you can look at an audiogram and you could say, well, this person has a hearing loss, but you also have to speak to the person and see if they notice they have a hearing loss and how that hearing loss is affecting them. So that objective information and the subjective information is important. Interestingly, people with normal audiograms, some of them still have difficulty understanding. So it's misleading when most doctors just look at the audiogram and they'll say, you're not a candidate, you are a candidate. You have to go beyond that because there are a lot of people who should be seeking assistance and are not. So there are 5 major manufacturers. So we have the FDA, and about 2 or 3 years ago, approved what's called OTC hearing aids, over-the-counter hearing aids. And that's one category of hearing aids. And then we have prescription hearing aids. That's another category of hearing aids. The difference is that the OTC hearing aids, people don't have to go to a physician. You see advertisements all the time. They're not proven yet because there's so many that are coming to market. And those don't require an audiologist. You can go into a drugstore, you can go in Walgreens and buy these things. But the Apple has come out with an app, and if you use your AirPods, you can use that as a hearing aid. And for some people, it does work. Those are the over the counter. But for people who have a hearing loss that seems to is kind of mild to moderate and is affecting their independence and is affecting their enjoyment of life, they should go to an audiologist. And there are 5 hearing aid manufacturers that make different brands of hearing aids. And we don't really know if one brand is better than the other, but there are a lot of for example, Oticon is a brand, Stignia is a brand, Resound is a brand. It's all these different brands. And the best way of knowing, and you can't just say, well, I want the best, because we don't know what the best is. And the audiologist will say, well, this is the best because this is what I'm selling. You have to really try. In my opinion, it's important to try 1 or 2 and to compare. So, and you could you'll be when somebody tries a hearing aid, you can notice the difference.
I'm fascinated by the Apple app because I literally just saw somebody do that in a class that I was teaching, and they put the iPad, the thingies in their ear, and all of a sudden they said, "Yeah, I'm okay now. I can hear you." The hearing. Talk to me a little bit about the impact of hearing loss on lifestyle and quality of life. The fact of, do people who do not do this or do not follow this direction or are on denial, the incidence of withdrawing from active life, of isolation, where there's so much isolation anyway. I'm sure you deal with this all the time.
So what's interesting is that my dissertation, which I wrote in 1980, was on hearing loss and social isolation in older adults.
You were ahead of your time.
I was very much ahead of my time, and nobody really appreciated social isolation. Nobody realized the significance of social disengagement. In fact, in the 1950s, 1960s, the sociological literature said it was normal for older people to disengage. But that's been disproven, and we now know that the biggest single factor contributing to longevity is social engagement. more so than smoking, more so than obesity. So that what happens as the mechanism why hearing is so important for engagement is that when people are in social situations, and if they're finding it increasingly difficult to communicate, especially in a noisy situation, and if they're struggling to put in a lot of effort to kind of understand what others are saying, and sometimes they say, "Well, you know what? I'm not really getting anything out of this conversation. I'm losing my motivation to participate because the rewards aren't in it to me. I'm not understanding what others are saying. I can't really contribute to the conversation, so I'm just going to withdraw." And the withdrawal is a problem because when people are isolated and low and also so there's a difference between social isolation and loneliness. So when people are isolated, there maybe that's it has to do with the number of people that they have contact with. For people who are lonely, it's really the perception of the quality of the interactions. So with people with hearing loss, they could be isolated and not lonely. It's the people who are that are feeling lonely because the quality of the conversation is not good. And so when people end up choosing to withdraw because it's easier than putting in the time and the effort, that's a problem because um, engagement is protective against cognitive changes in the brain. So when we socially engage, that's healthy. But when people disengage, that there are changes that take place actually in the brain. So social withdrawal impacts the brain, and that could lead to some cognitive decline.
Yeah, well, following up on that, parenthetically, the Jewish texts themselves maintain, and as you alluded to, there's this overwhelming interconnection of all the parts of the body and the
Right.
soul, and then nothing is isolated. And so, as you're alluding to, from my understanding in doing some reading before we talk, that the research is again just piling on this idea that, as you were alluding to, the hearing loss is affecting the what happens in the brain, isolation, other things. There's this total interaction. So now we're seeing literature, and we alluded to this before we went on the program, that there's a marker, or you'll tell me if I'm using the wrong word, or studies indicating that hearing loss can lead to dementia.
Cognitive decline, yeah.
Yeah. So how true is this, so that people, will read an article saying, "Oh, I'm losing my hearing, therefore the next stop is dementia."
Right. So it's not true. The science has not proven that. Social media has talked about that. The manufacturers are leading you to believe that if you have a hearing loss, you're going to get dementia. And oftentimes, when you go to an audiologist, they're going to say, the hearing loss causes dementia, hearing aids cure dementia. That is just the science, and we're not there yet. There's one randomized controlled trial that showed a connection, but if it was a very, very small connection, and the media built it up, and the statistics are not there. But we do know that hearing aids are helpful just because it helps the quality of life. So we want to do something about our hearing, not because we want to prevent dementia necessarily. We want to do something about our hearing because hearing is important to well-being. Hearing enables you to stay connected with people, and that's going to be protective. And that's really what's important. So hearing aids in and of themselves are important because they're going to help assure a good quality of life. People who have, last year I was at a conference and I did a presentation with one of my colleagues, an MD, and a lot of the people who have hearing loss, which is already stigmatized, and then when they go to the audiologist and the audiologist says, "Well, you need to get hearing aids because you don't want to get dementia," a lot of the patients are upset because dementia is stigmatizing as well. So it's like a double stigma. So it's that hearing. The hearing is important for connecting, and it's important for wellness. And we need a lot more literature to show that hearing loss causes dementia. Dementia is just so complicated. And hearing aids cannot, first of all, there are different types of dementia. There are different causes of dementia. And hearing aids are not a cure. They are not going to cure dementia. They're going to enable people to engage and communicate more effectively, which is protective.
This system of, as you're talking about, of interconnection. So we're also beginning to see more and more, and I ran into this, to be blunt about it, with my own mom, when a pharmacist called me over when I went to fill a prescription and said, do you know that this medication, well, it doesn't get along, this pill doesn't get along with that pill that your mother's on. Talk to us a little bit about, a lot of people are on a lot of different medications. How do they guard against it? Well, this medication may affect my hearing, or I'm sure you've run into that.
Well, it's interesting just talking about medication and multimorbidity. Hearing loss is connected to cardiovascular disease. Hearing loss is connected to diabetes. Hearing loss is connected to kidney disease. So there's a connection between hearing and multimorbidity. Even when people are going to the physician, it's really important that people tell the doctor and to the rabbi, this is how you have to communicate with me because I have difficulty hearing and understanding. I think that's really, really important. In terms of medication, there are certain medications that are going to be toxic to the ear. So, for example, when people undergo cancer treatments for life, could be life-saving, they're going to monitor the hearing because some of the medications are toxic to the ear and also to the balance mechanism. So the ear subserves hearing and the ear subserves balance. So a lot of people don't associate hearing with balance, but hearing loss is a risk factor for falls. And sometimes hearing can contribute to balance issues. And sometimes a balance issue can be a symptom of some kind of an ear disease. So there is a connection between hearing loss and falls, which people aren't aware of.
Yeah, it's just fascinating. The more you talk of the total interconnection of all the parts of the body is just so fascinating. And my experience is we just don't talk about this interconnectedness enough. Everybody has a little niche, but the niches all talk to each other, so to speak. Something else that we see a lot more of as we get old, vertigo.
Right, that's dizziness. That's the spinning, right?
Right.
So that's associated with certain ear diseases so there are three parts of the ear: the outer part, the middle, and the inner part, and then of course the brain. So there are conditions that affect the ear where dizziness, spinning is associated with that. So sometimes, the U.S. Preventive Services Task Force says if somebody has fallen, they should be referred to a professional if they have one of those risk factors. And risk factors for falls is hearing loss. And dizziness, spinning could be a symptom of many things, but one of those things could be hearing. Just like tinnitus, ringing in the ears. I'm sure you have people who say,
"Oh yeah,
ringing in the ears." That's a symptom of hearing loss as well, and it could be a symptom of something more significant, but it's a symptom of hearing loss.
And they can treat the tinnitus, right?
Well, tinnitus is very, very, it's complicated. Tinnitus, we don't really appreciate why people have tinnitus. Sometimes tinnitus could be associated with the medication, but everybody who has tinnitus most likely has a hearing loss, but everybody who has a hearing loss does not have tinnitus. And for tinnitus, there are different treatments that we try. Sometimes a doctor will prescribe an anti-anxiety or an antidepressant, and sometimes hearing aids actually help. You don't know, we can't predict. But I have a friend of mine who, she had very, very bad disabling tinnitus, and I said, well, let's try a hearing aid. And it worked. It helped her with the tinnitus, which you don't know until you try it. But she didn't really have a big hearing loss, but she had this tinnitus, and it's remarkable. So sometimes for that ringing, we give people noise maskers to give them a masking noise that's going to block out the tinnitus. But tinnitus could be very disabling for a lot of people, and we're not exactly sure why people have it, but it's definitely associated with hearing loss.
How important is the genetics in a person in hearing loss?
Well, hearing loss and aging, it looks like there might be a genetic factor with women. So if your mother has one,
Really?
maybe,
Really?
yeah. But it's not that. There are genetic causes of hearing loss in children for sure. And there's a middle ear disease called otosclerosis, which has a genetic component as well. So there could be a small genetic component. Could be familial.
And could you talk to us a little bit about something else that people may have experienced, and the cochlear implant?
Yeah. So there are a lot of different interventions for hearing loss. You have these OTC hearing aids. You have the AirPods now with the Apple. You have the hearing aids. And for some people, when they have this very, very significant hearing loss, they've been using hearing aids for a while. And then the hearing aids, and so the hearing aid, you can get a remote microphone to help you understand better. So the closer the microphone is to the speaker, the better you'll be able to understand people when they're speaking. So hearing aids, there are a lot of accessories you can get. But at some point, sometimes the auditory processing is damaged. The hearing loss gets so significant that people are having significant difficulty functioning with the hearing aid. That's when you should get a cochlear implant. The cochlear implants are life-saving, life-changing for people who have significant hearing loss in both ears, and now people who have significant hearing loss in one ear can be candidates for cochlear implant. So when people are struggling with their hearing loss, struggling with the hearing aids don't seem to be working. They're trying different things, but they're not working. The next thing is a cochlear implant evaluation. And I mean, the people that I've worked with, it's really a mitzvah for people to go that next step, because it really makes a difference. And age is not disqualifying. Cochlear implants are amazing. But I want to also mention that so for example, when you go to, for example, visit patients in a hospital, or you're talking to people about end of life, communication is what individuals have. That's the last thing perhaps they might have. So, and when they're at that stage, oftentimes, if they have a hearing loss, they're not going to necessarily wear hearing aids. But there's a device called it's a personal amplifier. It's a pocket talker, which I think every single doctor and I think every single rabbi should carry with them, especially when they do home visits and talking to family members. Basically, it's an amplifier, and it's attached to a microphone, and then you communicate with the person, so they can actually communicate with you. And it's easier to communicate. It's easier for the rabbi to communicate. It's easier for the patient to communicate. And these are for people who, for example, have hearing difficulty, but they're homebound. They're possibly very, very ill. They're not going to put the hearing aids on. But these pocket talkers, and I can send you the information, are really, really important. A personal amplifier. I think it's really, really important.
What is it? What's it called? A personal amplifier?
Yeah, it's called a personal amplifier. It's called, there's the one that we use that we do. I'm doing research in an emergency department at the different veterans hospitals throughout the country. And we're using a pocket talker, which is essentially an amplifier. I have one in my room. I should have brought it, but
that's okay.
And it's just, basically you stick the headphones on the patient, just turn the switch on, and it just, you can communicate, and it just, people's faces light up, because it's all of a sudden just make the sound louder, and it makes it easier. But actually the iPhone, if people have the AirPods, we have this works the same way, but some people don't have, some of the older people don't have smartphones.
Technology is going to change a lot of this, do you think?
Yeah. Especially, the AirPods, there's a lot of research showing that they do make a difference. But also what's interesting is that there's for people who have difficulty on the telephone, so there are a lot of people. So you mentioned before that you saw somebody was streaming when they were using the hearing aids, the telephone streams to the hearing aids. So I did some work last year with a company where they have closed captioning on the smartphone, so that you could be talking on the phone and you get these captions automatically. And by combining hearing and vision, it really makes a difference, because some people are still going to have difficulty on the phone. And also there are apps, for example, if you have a smartphone, like I was at a meeting recently, and this woman who had a cochlear implant had the phone out, And I said, well, what's that? It turned out it's a captioner. We were at dinner, and she was having difficulty hearing with a cochlear implant. So she basically took out her phone and it transcribed everything everybody was saying. So the technology is amazing. The technology is amazing.
It's just another world. One of the things I also have to ask you, because there are people who will be watching or listening to this, who will be, giving a talk or giving a lecture or doing Torah study or even doing services or teaching. And the question that it's sort of like the reverse: how do I make sure if I'm giving a talk, that I know how to that everybody can
To
hear me?
optimize the communication.
Correct.
Okay, so you want to make sure that there's no noise in the room, minimize distractions. So, for example, some of my colleagues from my friends from the synagogue are doing adult education. And they're taking these wonderful courses. Like all these people who are retired are teaching these very, very sophisticated things. But what happened is there's a air conditioner and there's a buzz, for example, in the room. So the people can't hear the individuals when they're asking questions. So there's technology for that. So we're getting some technology for that. In the sanctuaries, I mean, there's looping to help with people who wear hearing aids, and then there's personal devices that people can get when they walk into certain synagogues. But removing noise, making sure that, for example, people who have hearing loss should be as close to the front as possible. That's very important. It's important to make sure you can't speak too quickly, but you don't want to slow down because you want it to natural. And it's also helpful to get people's attention when they're speaking. And speaking in a different room, like if your wife is in the kitchen and you're in the bedroom in the dining room, they're not going to be able to communicate with you. So you want to make sure that people are close, and it's important to face the speaker. It's good to have some light on the face, because looking at people's faces, it does definitely optimizes communication.
The following is a tough question, but it's just it's just too relevant. And I have to ask you this. Given the current state of the government and the approach to, I think you just answered the question. What I anticipate is going to be a look at Medicaid, Medicare. How fragile are the insurance reimbursements or reimbursements for hearing loss? So those things associated with hearing loss.
So what's interesting about reimbursement is that Medicare will pay for cochlear implants, which is a surgical procedure. So that's for people over 65. Medicare does not pay for hearing aids. There are certain plans, more and more, there are some advantage plans that will contribute to hearing aids. And more there are health plans that are paying for hearing aids. But the government the FDA decided to approve these over-the-counter hearing aids to make them more affordable and more accessible. But again, Medicare does, and now Medicare, just before Trump got in office, Medicare decided that they're not going to pay for audiologists to do telehealth visits. So already we're on the chopping block, and that was before the new administration. But Medicare does not pay for hearing aids, and I don't. And Elizabeth Warren and Grassley, they've been proponents of trying to get Medicare to pay, but I'm not optimistic now, because they haven't paid in a long time, and now, of course, I don't think that's going to happen.
Yeah, it's something to be very cognizant of the fact, because look, given the growth of the over 65 population in the country, especially in the Jewish community, it is a social justice issue in many ways.
But I think I just want to add one thing, just to, kudos to the religious organizations, just having all these lectures and all these programs for adults learning Jewish education. It's just so important for people to socialize. The socialization that comes from the community that a synagogue offers or a JCC, it's just so important. The social engagement is just so important for older adults, and it's protective, and it's also critical to life expectancy.
And more people as a result of the pandemic, but they're saying with more and more people are going in the Jewish community and around the world, but to these lectures and on Zoom. They're very comfortable with sitting in my living room, and I can adjust, as you just saying, I have the ability to hear better and
you have closed captioning. You might, like when I teach virtually many times, and I have closed captioning, so I just turn on the closed captioning, and that's very helpful. The Zooming, I think the Zooming is great.
Yeah, it's really transformed everything, and really in many ways for the better. Especially, well, there's another story for another time. Before we run out of time and have to close, just a real easy end question for the people who are listening, who are thinking about, they may be dealing with hearing loss, their mother, their father, their spouse, etc. What's the one piece of advice that you want to give people?
It's really, really important to protect your hearing. That's one thing you want to, because it's important. It's a social sense and a safety sense. And the earlier it's good to get a baseline hearing test, because the younger you are, when you kind of detect that you have difficulty and you start trying some of these more affordable devices, you realize how much you're benefiting and how much better off you are in terms of your overall quality of life when you can hear and communicate with others. So don't postpone it. Don't put it off. There's no downside to getting a baseline, and it's also important to protect your hearing. So in noisy bar mitzvahs, noisy weddings, not a great thing.
You know, I've actually started to run into families in weddings and bar mitzvahs who will have a quiet room.
Yeah, that's interesting.
And so, because people who just, they usually sit us right in front of the speaker.
Right.
But say, if you want to have a conversation, there's a room that you can go sit, have a cup of coffee and the cake, and sit and talk. You don't have to listen to,
Well, I have an app on my phone. It's a sound level meter. So whenever I'm in a noisy environment and some kind of affair, I go up to the band and I say, that's 100 decibels. I think you should lower it. So it's always good to
it comes up on the Apple Watch.
Oh yeah, it comes up on the Apple
Watch. Usually when I'm in a game, it says you're in a dangerous and there's too much noise.
Well, it came up when I was in the emergency department up at Mount Sinai. It came up in the emergency department at Sinai. This is a noisy environment. Those hospitals are very, very noisy. It was really amazing.
That's funny.
Yeah, but it really is good about this.
No, it's great. It's great because who would know? 20 years ago, who would know? 10 years ago, who would know?
Yeah.
Dr. Barbara Weinstein, thank you very, very much. Congratulations again on the award.
Thank you.
Thank you very much for your time, and just stay safe and stay healthy and stay well.
You too.
Take care.
Nice to meet you. Thank you very much.
To all of you, thank you very, very much for joining us on today's editions of Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. If you would like to comment on programs or suggestions, again, just email me at rabbiaddress@jewishsacredaging.com. If you'd like to sponsor part of these programs or some of the podcasts, again, just email me. We'll take it from there. If you'd like to support the programming, please just go to the website, jewishsacredaging.com, and there's a conveniently located donate button right there. It's hard to miss, and just follow the prompts. Seekers of Meaning is produced at the Broadcast Center of Lubetkin Media Companies in beautiful, lovely, quiet Cherry Hill, New Jersey, and a big shout out to our producer, Steve Lubetkin. Again, thank you for joining us. We're very appreciative of your being with us. Take care, everyone. Until we see each other again, stay safe, stay healthy, and be kind to one another. Shalom.